So I think we're going to get started now. We've got a couple of people just entering into the session. Welcome everybody. Welcome to our kick-off session of our week-long gathering for the Health Anchors Learning Network. My name is William Roberts. I'm part of the team at Innovation Unit, and I'm here with my colleague Gweno, who will be supporting me this morning on our session. We're just going to kick off with just a little bit of housekeeping. I think everybody, after 15 months of Zoom, Microsoft Teams, Google Hangouts, and every other bit of technology under the sun, knows how to use technology. So I won't be telling you how to run your computers this morning, but if you are having any technical difficulties, if there was something you missed or you need something, just go to the chat and send a message to my colleague Gweno Edwards, who will be able to help you and to support you this morning. Just so you know, we're recording this morning so that we can share the presentations with those who aren't able to join us, and also they're allowing people so that we can take the Q&A away to understand the kind of things you're interested in and the answers that you're giving. Any breakout rooms won't be recorded, however, so don't worry, you have some freedom to speak in those spaces and the opportunity to do so, but we won't be recording that. We're going to be using Slido, so if you're familiar with Slido, please do open it up. If you have a separate device, you may want to use that or not, but that's where we're going to be doing the interactivity with you in the first part. I'm not going to take you through the agenda. We've got lots to cover today. We're going to open up in a minute with my colleague Julia Slay, who's going to give us a little bit of a taster and a starter about a sort of Anchors 101, if you like. And for some of you, that will be very old hat and something you've heard before. And for others, that will be new. So please bear with us whilst we do that. Then we're going to give you a little bit of time to ask some questions, but also some opportunity for you to connect in small groups. Then we'll be having a conversation with Julia and Michael from NHS Confed, who'll then be taking some of your questions. And then at the end, we're just going to give you a brief about what's happening. So I'm going to move on now. I'm going to hand over to my colleague Julia. Without further ado, if you're going to use the Slido, go to slido.com and our hashtag Helm, and that's how you're going to do it. But if you're struggling with Slido, you can just put questions and answers into the Zoom chat. Lovely. So Julia, before we go to you, I'm just going to ask people on Slido if you could go in now, and we'd just like to get a sense of where you are. So as I said, some of you will be at different parts of your journey. Some of you are going to be right at the beginning. Some of you are going to be absolutely miles on with this work and really advanced. So if you go to www.slido.com #Helm, and please click on one of the options you've got there as to which of those applies to you. We'll give you a little bit of time to do that. I can see we've had a few people do that so far. But if we'll just give you a little bit longer, and then Julia, I'll hand over to you. So we've got a really interesting mix of things coming up on there so far from the responses. Some of you are just starting. Some of you are doing some work in this. Some of you for whom this isn't your day job or something you're responsible for. And for others, you're a little bit further on. So I'm just going to give that an extra 30 seconds or so for anybody who would like to do that. Brilliant. So Julia, shall I hand over to you and give it to you to take away?
Thank you, William. Really, really interesting to see that Slido poll as well. Lots of you at the beginning, some of you already well underway, some getting started. So yeah, a real mix with us today. And really, I'm just going to set the scene, speak for 5 minutes, probably not more than that, on what we're talking about. So this will not be new for some of you, but we want to make sure that everyone's kind of starting from the same starting point. So when we talk about anchor organizations or anchor institutions, what do we mean? Really, what we're talking about is large, often public sector organizations that are rooted in place So either because they're delivering services in a particular geography, like a town, a city, or a region, they have really significant assets in that place, and or they have historically always been based there, and well into the future you would expect them to be based there. So classic examples would be hospitals, museums, local authorities, sometimes transport infrastructure. And they are often the biggest employers and spenders within that region or town or city. So they have real kind of economic power. Just by existing and getting up in the morning, they can exert a real influence on the local economy. And they can do that in a range of ways, which we'll talk a little bit more about, including who they employ and how they employ them, what they spend on goods and services, the way they work with local communities, and the way they think about their environmental impact. And a word that you'll hear often when we're talking about anchor organizations is intentionality. So thinking about using all the resources as much more intentionally to benefit local economy, local community. I think we've got some feedback, so if you could pop yourselves on mute if you're not, that would be fab. Thank you. I think we caught it there. Fab. Gwenno, if we could pop on to the next slide. Super. And increasingly, what we're seeing emerge in some areas across the UK are anchor collaboratives or networks. So these are place-based collaboratives of different anchor organizations working together around common objectives. So you might have a university working with a hospital, an NHS trust, possibly with a local authority, sometimes with some arts and cultural partners or higher education partners, sometimes an interesting range of other partners too. And they are coming together and thinking about how all of their collective efforts in that region or town might have a bigger social, environmental, and economic impact. Fab, if we could hop on one slide, Gwenno. So why does this matter? Why are we talking about this now? I mean, there's a whole host of reasons. First and foremost, it is about that intentionality point. You know, anchor organizations have the potential to really impact the determinants of health and narrow health inequalities. And many anchor organizations that are kind of further on in their work have been able to show having a real impact on employment conditions, sometimes on factors such as housing, on the environment. But it requires focus. It requires having a clear objective with how you use your procurement, how you use your HR policies, how you use your assets and infrastructure investment. So it's thinking about all of the resources that we have to tackle things like health inequalities and the determinants of health. These are often the more preventative upstream issues related to what some anchor organizations might be delivering services for on their front line. So there is a kind of relationship between the services that are being delivered and the conditions in which people in the community live. It's often about engaging teams and leaders who work in the more corporate functions with some of the missions and objectives of, again, the kind of services arm of anchor organizations. So often we'll be talking to leaders in anchor organizations who lead commercial services functions or procurement or HR, sometimes also in public health, but often we're talking to people who haven't necessarily historically been involved in kind of organizational conversations about tackling health inequalities, and yet their functions have a huge amount to offer. And it matters now because there's some really important policy directives coming out, which we'll be talking about more today and throughout the week, and kind of a really renewed focus, I think, on place-based collaboration, and anchors as an agenda speaks to all of that. Okay, Gwenno, if we could hop on one slide. Thank you. Briefly, I just wanted to summarize the key anchor strategies. So there's different ways you can cut this, and different organizations will have their own language around it, which is great. And different anchors will often have assets that reflect a smaller number of these strategies. So not every anchor will necessarily be able to deploy all of these strategies, but these are the most common ones we tend to see. As I said, two of the biggies are procurement and spending, and workforce and employment. So kind of who you employ and what you spend. Procurement and spending is really thinking about how every pound that is spent by an organisation, by an anchor on goods and services, can benefit the local population and the local economy, and how it can be done so really intentionally against some specific social, environmental and economic outcomes that matter to that place. And that will look different if you're in Cumbria to if you're in Newham. So it's really important that it's contextual and that it's specific to the local area. Force, employment and skills, there's a whole range of things that anchor organisations can do on this, and we've got a specific session coming up later today on that. But it includes not just thinking about how you progress and develop your existing workforce, but pre-employment programmes and partnerships with the local community and with higher education institutions to think about who you bring into your workforce. So tackling perhaps inequalities in the labour market through bringing groups in who are underrepresented or face really additional barriers to employment. Third down there is thinking about estates and infrastructure investment. So thinking about the kind of physical spaces of which anchor organisations are often very, very rich in. They often have really, really significant estates, and will often be leading new infrastructure investment in a town, region or economy that has the potential to drive huge change for the local area, and might bring in other strategies like workforce and skills, like procurement and spending, but through the particular investment opportunity that's happening. So big hospital redevelopments might be a classic example, and there's a number of those going on at the moment across the UK. Another kind of anchor strategy is thinking about reducing the environmental impact of anchor organisations. And this, again, there's a bit of cross-referencing here. It can speak to estates and how we run our buildings. It can also speak to workforce and thinking about the incentives that the workforce have to travel differently, or the behaviours that they take part in the workplace. But for the NHS in particular, this is a really, really, really big agenda. And then we've got thinking about working with other local anchor partners. So there will be much in common that NHS anchors in particular have, for example, with local authorities, with arts and cultural institutions, with universities and higher education institutions, not least often a shared population. There might not always be entirely coterminous, but often you'll have a really, really shared population. And often also some shared suppliers and community-based organizations. So if you're thinking about wanting to increase spending, for example, with small social enterprises, that is a kind of sector that within the local economy that you might share with a number of other anchors. So there are opportunities for collaboration and shared investment. And lastly, but definitely not least, is thinking about community engagement and civic action. Again, this strategy can look very different depending on the anchor organisation and depending on where you are. It can involve thinking about civic engagement, voter registration. There's a whole range of activities that some anchors have underway. It can also involve really close partnerships with community organisations, grant making, board representation, thinking about the places and spaces that you have that are available to the local community. So again, a really wide range of activities can come under that strategy. Gwenna, if we could pop on one slide. Thank you. Briefly, just what are the kind of big ideas behind this? There's three here. There are lots more, but just in summary, one of the kind of core concepts of anchor organizations is the idea of sticky capital. So the reason why anchor organizations can perhaps do things that other organizations can't is because they are bound to the community in which they exist. We have a really high level of certainty that they will still be in that place, perhaps in 100 years or 150 years. So they can make perhaps longer term decisions, and often their objective or their mission is really closely tied to the health, well-being and prosperity of the community that they serve. They are economic actors, and often they don't necessarily think of themselves as economic actors, but they have a really, really, really strong potential to exert an influence on the local economy. And this is all linked to wider ideas about community wealth building and democratizing the economy. So thinking about who owns different parts of the economy, thinking about local money flows, that's quite a kind of big concept in anchor organizations. Where does your investment go? Does it stay within the local economy? Does it pull out of the local economy when you have big capital investment projects? Who benefits from that? Do local residents benefit from that? Are we able to track the benefit? So those are some of the kind of big ideas behind all of this. And last but not least, I think, is there one more slide, Gwenna? No, we're done. Okay, that was a kind of whistle-stop tour into anchor organizations. There's lots more that we could say and lots more that will be coming out on all those specific strategies this week. But for now, I will hand back over to William.
Thank you, Julia. And for those of you who've been listening there and you've got questions that are starting to come up, please do go over to Slido and you can ask your questions there as well. And there'll be an opportunity as well after we send you off into small groups to also have a conversation and to ask some questions of Michael and Julia, who'll probably go into a bit more depth on some of that. So we'll come back to that. So now I think we are going to have a quick question for you. So we want to send you off into small groups. You'll be in a group of 3, hopefully, I believe, Gweno. We're going to give you about 10 minutes just to talk to the people in the room with you. And really, we want you to talk about what sparked your interest in this. So take a moment to introduce yourself to the people in your group. Talk about what sparked your interest and share with the people in that group what you're excited by, the stuff you're doing. And bear in mind, it'll be a really diverse set of people. You could end up with anybody. So go away, have 10 minutes in your small groups. We'll automatically move you into them and we'll give you a warning when it's about to finish and bring you back. And when you come back from that, do use the chat function to share anything you've been really interested in or excited by. So if you've heard something really good or you've seen something really exciting, please do use the chat function to share that with the wider group of people. So we're going to send you off in a moment into your small groups. I can see Gweno is making those rooms now for us. Are we ready to go? Perfect. So hopefully in the next few seconds, you'll get the option to join a group, join that group, and then we shall see you back in the room in about 10 minutes. Lovely.
There we go, we've got a few people coming back and everyone's got their 60-second timer to come back, so you'll be joined by everyone else shortly.
Great, and if you've got a few seconds spare and you want to, please do go over to Slido and ask your questions for Michael and Julia. We'll be pulling them up in a second and asking them questions. So do feel free to go to slido.com #Helm, and there you can ask your questions that you'd like both Michael and Julia to answer. Don't be shy. Also, as you're coming back, if you heard something really interesting or something you'd like to share, please do that in the chat, because obviously we're not privy to the conversations you had. And if you heard something that you think you'd like to share with other people, please do put it in the chat, because it's really helpful for us to understand about the exciting and interesting things people are doing. So feel free to go to the chat function and just drop in anything that you're there. I know a number of you are doing some really quite interesting things from our launch session. We get the sudden burst of everybody back in as the rooms automatically close. So there's either a lot of people who are glad the rooms have closed or deeply disappointed that their conversations got cut short. So thanks for coming back, everybody. I've got 2 quick jobs for you. If you've got anything interesting that you heard in your breakout rooms that you'd like to share with the wider group, please put it into the chat function, type it in there. Also, please do go over to slido.com #Helm. And in there, ask your questions for Julia and Michael. And once we've got everybody back, we're going to be going over to you, Julia and Michael, and we'll kick off with some questions. Has Michael made it back yet, Gweno? He's back, I can see him.
Yeah, he's waving. We're all back.
Great, so everybody's back. So yeah, please do go to slido.com #Helm to ask any questions that you would like to ask. There's a question in there at the moment about slides. Yes, we will absolutely share the slides. We've also produced a slightly longer video version of that with a few extra slides in it for you as well, which we'll make available to people as well. So please do see that when it comes in. In a moment, we're going to kick off with questions. So please do start to get your questions in. Michael, Julia, I'm going to kick off with a quick question from me because the group seem quite shy at the moment. But a quick question from me really is, you know, we're all very busy. It's a crowded policy area. Is this just the latest zeitgeist policy from somebody from the States, or should we really care about this? And I don't mind which one of the two of you starts with that question.
I'm happy to go for it, Michael. You go.
No, you go, Julie. Then I'll chip in.
Well, I was just going to say, I really hope not, because I think some of the I've been lucky enough to spend some time out in the States with a lot of anchors, and I think that many of them have been working on this consistently for 10, 15 years. And I think it is a long-term program of work. I think to see there are definitely quick wins, but to see real benefits, you do need to have quite a long-term perspective. And I think that although the language of anchors might be newer, many of the strategies and practices are quite embedded in some ways in organizations. A lot of the procurement work is around social value, thinking about the social value impact of procurement, and that's become much more common to think about and to embed into practice over the last 8-9 years. Likewise on kind of regeneration and infrastructure investment and workforce, there are some organizations that have really well established practices around that. I think what the anchors language is doing is offering a kind of framework to bring them together and to really challenge us to think about who benefits from that and how they kind of knitted in together. Yeah, that would be my starter for 10. What do you think, Michael?
Well, I would start by saying I don't think place relationships are ever not important, William, in that perspective. So, what we're talking about here is how you work with local partners to realise the potential of where you live and to improve people's health, narrow inequalities, make your place the best it can be. And I don't think that will never not matter. And actually, as Julia set out in the slides, not only at the moment are we looking at specific tools to do just this, the policy agenda is moving this way. So actually, those of us that are looking at this and rolling our sleeves up and looking at the local place partnerships are actually doing the exciting bit of these pretty, you can imagine pretty tedious structural questions coming down the road. So what I would say is this is, the policy is moving this way, but place leadership matters always is I think the most important thing for me, William.
Right, and I mean, when we did the poll at the start, there was a huge variety of where people were on that. I mean, but a lot of people were saying they're just getting started. So for both of you, you've both worked with people on the ground doing this. What's your sort of, what's your advice about how to kick off and get started with this work?
Shall I start with that, Julie, and then we'll switch as we go through? I think sometimes there's two ways to look at this. One way is what can my organisation do? Where are some of the early steps we can take? But the other point is, what is the external context in which we're sitting and how is that changing? So I'm doing some work in London at the moment, and just to look through that dual lens, if we look outside the NHS, there's now a London Recovery Board set up. You've got the Mayor and London Councils leading that. That is in itself setting and making clear the external cultural, economic and social context in which we sit. And that is looking at London's economic future. So that straight away gives me some priorities for me to think, well, actually, these are some of the issues clearly where there's a lot of civic interest. I need to take steps in those areas. If that structure isn't there locally, then given the NHS is quite unique in that we're everywhere, then we always know that those issues that Julia mentioned, we always know they will matter. So that's a good rule of thumb as to where we start. But we do need to bring that external context in at some point to know where our value truly lies. That's the starting point, William. And of course, it's the nuance and the local, the variations on place might differ. But for me, that's a really interesting starting conversation to have.
Yeah, I think I would 100% agree with you on context, and kind of linked to that. I think often a starting point I hear from organizations is, what's the problem we're trying to solve? What is the need that is really unique to our area or the community in which we're based, and be led in part by that. So is that about the characteristics of unemployment in the area? Is that about there's a massive infrastructure investment project, and as of yet we haven't really determined how we want the local area to benefit? Is it that we have a huge number of contracts on goods and services up for renewal, so there's maybe tens of millions of pounds that we could be thinking about more specifically? So or is there a kind of depleted high street, and actually what we want to do is try and inject some resource and money and energy into that, and hence maybe a link back to the procurement side of things. I think the other common starting point, which is a really important one, is getting very specific very quickly about who or what you want to move. What's the change? Is it for a particular group? So do you live in, do you work, or are you based in an area that has really deep inequalities for one particular part of the population, or a particular ward or area within the region or town? And what's the difference you want to make to that group? And I think certainly a lot of learning from anchors that are really far on in their journey is that they can talk about the groups that they want to benefit from their work as an anchor. And they can then talk about the ways in which they think their anchor strategies can benefit those groups or those particular, ward or even smaller areas. And then linked to that, the next kind of starting point, I think, is around data. So having really good quality data you can use to measure your baseline and then set some objectives around that. So many anchor organizations would collect data around their baseline spend in their procurement, looking at where that goes in terms of local. So defining local becomes quite an important first step. And they might also be looking at data around their workforce, and using that to set some objectives about where they'd like to get to. So I think for me, the kind of context, what's the need or the problem, what's the group or the area you want to benefit, and what's the data are the most important starting points to build off from.
If I can just add to William before you come in, we shouldn't be afraid of being opportunistic. As Julia set out, there might be a huge regeneration plan, that is cutting through our locality. There might be an NHS capital plan. That itself has been the spur for anchor working, system working in some parts of the country. So don't be afraid of, there are several, it's like a porous agenda, isn't it? So there's several starting points. Don't be afraid of being opportunistic about this.
And there's a couple of questions in Slido, so I'm going to put a couple of them out there and let you all just sort of pick which ones you like the most. So Andrew Atfield, who's done some great work out in East London, has asked a question about how, this is a broad agenda. So how do we think about focus? So that's one question of how do you actually focus people down to actually make a difference? There's a great question about, COVID recovery and how do we make this relevant now? Because obviously a lot of this work is 3 to 10 years probably to show real benefits, but what could be the here and now options? And there's also some other questions in there about people have been asking, how do we best learn? So there's a question from Tim about where, what do we see as the best practice that we can learn from? Is it places like Manchester? Or are there others out there? And also some other questions earlier on about how do we best get and learn from other places? Because that's something, historically the NHS hasn't been great at learning. So 3-4 sort of groups of questions there. I don't know who'd like to come in.
Just on the focus, there's something about, and this is where it gets tricky. There's something about where our value might be best utilized, perhaps is not an area where there's lots of energy in our colleagues to take that step. So for me, sometimes, and it does come back to that first step question, doesn't it, Julie, about sometimes we're having to move in an area where it may not be where we want to be ultimately, but there's a certain buzz, a policy buzz, or there's a local buzz around an initiative which has really moved people into the space where you can then focus and make a big difference. Sometimes that focus comes from outside the NHS. So, in a part of London, we're looking at, how can we adapt entry points and jobs brokerage systems for people believing that NHS jobs doesn't allow people without an NHS background to get into work. So some issue around there. There's Heathrow Airport, huge potential workforce vaccination programs. So sometimes there's an energy somewhere. which enables us to take a few steps down the road, crack a local nut, make change happen, and then we've opened up a wider potential. And the bigger ticket stuff is how we can change future policy, how we can upscale some of this. So what I would say about focus is, we might have an idea what we want to change at the moment, but it may not be possible, because we've got to take a few steps down the road to prove that what we're doing works, to bring people with us, to prove to ourselves, not just colleagues, that this works. Look for those and be opportunistic about that, but always have in mind the big ticket change we want to, the answer to the question we want to ask ourselves. So I hope that, and Andrew is a brilliant proponent of that, and Andrew can talk at length about the great work Barts are doing. So that I'll just answer that point, Julie, and I'll let you come in, Julie, and then we can pick up some of the other questions.
Yeah, it's really interesting questions, actually. I'm just having a little think. I mean, I think on focus, I think that, again, I would be guided by a focus on who you want to benefit from your power as an anchor. And I think unless you can get really quite specific about that, you run the risk of doing lots and it not necessarily having an impact. So I think in terms of focus, anchors that have often moved in quite far on this agenda, again, they are quite clear about the cohort or the group or the ward level area which they want to benefit. Certainly in the States, where a lot of the anchor work is perhaps slightly more advanced, and many of them have been doing it for a bit longer under this framework anyway, a very common group that they want to benefit are African American men. And they're particularly focused on tackling systemic racism, and they can be very clear about the ways in which they want to narrow unemployment gaps or spending gaps with African American owned businesses, or with particular areas of their city, town or region where that group live. So I think that having a really clear focus can then help you talk to your procurement teams, your workforce teams, your estates teams. Sometimes, I've met anchors working on kind of laundry and really niche parts of services that actually have quite high value contracts, all of whom are really focused on what they're doing to contribute towards better outcomes for that group or that particular area. I think there's something about kind of high risk, high reward. So I do think that some of the quick wins are really important to start to realign the whole system towards having a slightly more intentional impact on particular determinants of health, or again, those particular groups. But certainly some of the kind of anchors who I've spoken to who've had the most impact have said, we went for the biggest stuff. We went high risk, high reward, and we really felt like that paid off, because you can move some really significant amounts of money around. So we're talking kind of really big contracts of maybe 10 million plus, or really big infrastructure investment projects. And they did a lot. So they had a focus in terms of who they wanted to benefit, but they were still having all of these kind of corporate departments and frontline services realigning themselves around the particular benefit they wanted to have. And in terms of how do we learn, I mean, I think there'll be a huge amount of learning to come out of this network. I think generally, again, anchors, both in the UK and in other countries, have been quite good at publishing short summaries, blogs, sharing presentations, webinars. There's quite a lot online. It's kind of informal sharing and learning from what they've been doing, but there's an awful lot available, and we'll certainly be sharing a lot through this network too. I might pause there and see if you wanted to come back in, Michael.
I was just going to link the point on focus to the point on recovery. I mean, the recovery gives us an element of focus, doesn't it? The more we understand, we've seen inequalities are everyone's business now. That means health is everyone's business. There will be conversations going on in your local partner organisations about how inequalities matter for universities, for local government, for charities. These are conversations that actually, if we can link into, we can help shape their focus as well as bringing some. And there's also, there will be priorities for the economic and social recovery of your place. The high street's been mentioned. I mean, for me, the high street is almost a one-seal test. Health on the high street. We can all, I'm not commuting anymore. I've reconnected with my high street. I can see it from my window. It has been a manifestation of COVID. The empty shops, the community-owned businesses where the interest is. Where's the NHS on the high street? And actually, how can we embed health as that overarching principle that replaces retail, perhaps, as the reason we go to our high street? But where's the NHS on the high street? And what does how could a new out of hospital strategy be built on a basis which goes wider than just a clinical or cost basis. So you start to see the opportunities when we understand how our place recovers. And we all want our place to be the best it can be, don't we, personally and professionally? We shouldn't separate our hats in this. You know, we have a part in our place's recovery. So I think that those two are linked, but that window is now, you know, that window is open now.
I'm going to ask a couple more questions, and I'd also like us to do a poll in a minute about support, because obviously that's something that people have been asking some questions about in the box. I think I'm going to come with sort of three really different questions here. So there's been a few questions both in chat and on Slido about sort of the challenge of policy getting in the way. So, you know, not just policy, but also politics sometimes getting in the way. How does this agenda fit with some of the real challenges around whether it's procurement or employment policy, centrally driven, that could at times almost get in the way of doing this kind of work? So that's my sort of first question. The second one is we have quite a few people, and Varsha had put this in the chat, but some others as well had raised the question about sort of how do we take the opportunity of the sort of the surge we've seen in volunteering as an opportunity? And there's some interesting evidence on how difficult it is to turn volunteering into paid work, but how might we use the volunteering opportunity we're seeing probably as a once in a lifetime opportunity to engage a group of people? And then also I saw Matilda had put a bit of a feedback from one of the groups, which was about the idea of how do you get public health into our institutions as opposed to just in the local authority. So I'm going to put those three out, and then we're going to come to a quiz a bit later. So who wants to go first on those three questions? Policy getting in the way, opportunity of volunteering, and public health as a wider commodity.
I'm happy to kick off with volunteering, actually. I agree I think that's a really interesting opportunity, and something where there has been, it's a new asset, it's a new strength, right? So there have been thousands, hundreds of thousands of volunteers working with the NHS, helping to deliver vaccination clinics, you know, running mutual aid groups, doing delivery, you know, it has been incredible. And you know, from what I've been hearing locally, the flow of volunteers has not stopped yet. You know, they're still coming, they're still really interested, and I think that represents the opportunity for the NHS to develop a new relationship with people in its place that is not about service user involvement. It is about something quite different. The framing of that relationship is really, really, really different. And certainly if I think about some of the anchors in other towns and cities, both in the UK and abroad, that I've worked with, not many of them have had volunteering as a kind of key asset or strength that they've worked with. Many of them have thought about kind of community relationships, either through the lens of what is our expertise that we are bringing into communities and sharing. So is that about mental health first aid training, or universities running large scale research programs and building the skills of community researchers, or running voter registration drives? So it's been much more about deploying the anchors expertise into communities to upskill, train and build capacity, or providing kind of governance and leadership for community-based organizations. So I think this is a really interesting opportunity that we don't necessarily have a template or a model for, but I'm sure there are lots of ways in which we could be thinking about what does it mean for an anchor organization to hold a relationship with this group of people that is longer term, that builds on the energy and appetite that they've shown during this pandemic. And I'm sure people in the room, and I'd love to hear in the chat, you know, what they're thinking about this, because it is a massive opportunity and we shouldn't let it pass. I'll come back around to policy afterwards, but yeah, Michael, maybe over to you for now.
The policy question is really interesting, and this is where I think the real value of the network is. We're going to hear this week, and you're going to hear about, you know, tools and practical examples of change. We can make change happen on the ground. We can't change policy on the ground. What I'm really keen this network brings is an ability to have the intellectual debate. You know, this isn't about, you know, am I an anchor? It's about how, you know, what am I doing? Why are we doing this? What, you know, what can we, you know, what does need to happen? And I work in the policy world, you know, normally in London, the health policy world. This process is democratizing health policy. This isn't the think tanks and the people with policy in their job titles looking at the change. This is real change happening, and this is a discussion about different parts of the country, why we're doing different things, what does need to happen, how can we link in with non-NHS policy, which, quite often is isolated. There's a great comment in the chat about, a range of new funds and new processes and new local place, and spatial plans. So this for me is actually, that intellectual debate, William, is fascinating, and we need to make sure we are having it. In parallel with the tools, in parallel with the local examples, we need to systematically bring those together to help answer the big ticket questions and to push back on policy. I'm not sure we've had a forum like this before, if we look at it in that regard. So for me, I think that's really exciting.
Yeah, I mean, on policy, I do think that sometimes we get hung up on policy not being directive or permissive and, or permitting us. But actually, I think the current policy direction is quite clear that health inequalities are a really big issue that need to be tackled. Health anchors in particular, there's a kind of incentive and encouragement to work in place-based partnerships, to look at the determinants of health, to think more about their economic role. And I think that there's a lot of scope within that to implement facets of the anchors agenda. And I think we shouldn't be held back by hoping that something will come on the policy agenda. I think actually all of what we're talking about today is totally, permissible within the current policy context. And I think it gives us quite a lot to work with. I mean, I think what's interesting is that even though many people felt the Social Value Act as one example of where anchors on kind of procurement and spending might have had some supportive policy wasn't strong enough or didn't have enough teeth, those that wanted to took it really far and embedded some quite ambitious, really robust social value principles in their procurement. And I think the same applies to a lot of the strategies that we're talking about today. I think the environment is flexible enough to enable anchors to be quite ambitious about what they want to do. And certainly the kind of headline focus on health inequalities, place-based partnerships, it does feel like we have I think we have a kind of fairly supportive policy context for those.
Brilliant. So I'm going to take us to a quick poll because I'd like to hear from it. I think there's some fascinating stuff coming up in chat. We didn't answer the question about public health, so I'm going to come back to you on that in a minute. And I'm also going to ask another question about being fleet of foot around estates and how we really do that. And then a final thought about really asset-based community work. But if you as participants could go over to Slido again, we'd really like to hear from you here. And you can select 3 of these about what support you feel like you need the most to start doing this work. So that's going over to www.slido.com #Helm. And we'd like to just get a sense of where are the areas that you feel you would most value getting some support as a local organisation. So I'm going to give you all a few minutes to do it. We've got 48 odd participants, so we're up to 8 people who voted so far. So please do have a go and vote on. If you can't do that and you're struggling, do put it in the chat. You can do that as well. And then I'm going to come back to you two. Firstly, on the public health question, very quickly, because we need to do just a couple of minutes on this last set of questions before we get towards the end of our time. I'd also like to just have this question about how do we get to be more fleet of foot in decision making, because obviously a lot of decisions we need to make around some of this work with communities needs to be quick rather than slow. And then finally, just pick up a bit about how do we best really start to tackle this issue of really seeing what's strong rather than what's wrong in local communities. So I'm just going to give people a little bit more time to do this. It's helpful for us to be able to see what people are voting for. So please just put your final votes in. It's you can just tick them so you don't have to type. So it's nice and quick. And I'm just going to give it an extra few seconds. Brilliant. So whilst we're waiting on that, Julia, do you want to start on the question around public health? So how do we do that? Matilda's just said about that. It was less about public health teams, more about how we understand local inequalities, local data, and that wider sense of public health in organisations that perhaps haven't always thought about it.
Yeah, that's really helpful because I was just looking back at the chat, and thanks, Matilda, for expanding on that point. I agree. I think that essentially it sounds, I think public health teams do bring a really, really good grip on data, on local inequalities that other types of organisations won't necessarily have. So particularly on the data point and understanding the nuances of the local context, they can be a really, really valuable asset to have. And of course, in many place-based partnerships, the public health teams are sitting alongside and working alongside leaders of trusts and others. But I do think that bringing together their expertise with some of the really big kind of chunky economic levers that trusts have is a really exciting opportunity. And the academic point is a good one as well, because you know, most cities, certainly some towns and regions will have a university, if not, you know, some really pretty substantial higher education institutions. And they also will have really deep expertise into, in particular, thinking about the data and evidence of, you know, demographics in the local population. And I do think this is an agenda that needs to be quite data-led. You know, the most impressive anchor work I've seen is front and center led by data about the need and the demand around issues that they're trying to solve and the impact that they're tracking, which comes back to a point that came out of the slide there about the evidence base and how we measure and capture this. So I think that public health leads are a real asset in this, and I know that in many parts of the UK they're working really closely with anchor partners. Michael, what about you?
One thing that occurs to me on the whole agenda actually is just a need to link up conversations. Quite with my NHS hat on, how often do we in the NHS sort of itemize and, you know, different conversations? So it might be have a conversation about our world leading, you know, R&D with our universities and our, you know, how we drive innovation. That conversation is not in the same room as how we address local inequalities, what the public health needs are of our, you know, then we've got our estates separate. The value comes from linking these up. We're in a, you know, recovery from a huge recession. Never will public sector leaders have a greater say and influence in how their local place recovers and rebuilds. And actually, if we are in conversations about attracting with investment to a place, we need to make sure those conversations are with the same people talking about how, you know, what we are doing for those poorest wards, you know, those most deprived parts of our communities, and how we're linking that together. You know, we have a part to play in the rebuilding of our place. We can't sit back and in 5 years' time think this isn't the economy of the place, the society we wanted. We're part of that rebuild. And so I think, you know, just on that Julie's point, you know, our public health is in everyone's minds at the moment, isn't it? You know, if we don't have our director of public health involved in what we're doing locally, we are not doing it right. And that data is just, but it just occurred to me, William, in terms of all the questions and bringing this together, we cannot afford, if we dilute, if we itemize conversations, we dilute our voice, and we are actually contributing to making our place poorer.
And I guess we've picked up some of the stuff there about how we work with assets and this idea of a whole place-based approach to it, and really sort of thinking about the wider sense. What would then be, I guess, just sort of drawing us to a close on the questions before we do the last two bits of this, what would be your sort of, you know, 30-second elevator pitch for why this really matters and what you think people who've been on this this last 55 minutes of their time have given up, what should they do next? Go for it. Well, we'll start with you, Julia, and then we'll do you, Michael.
Thank you. I mean, I would say, I think that every single day, these anchor institutions that have such huge potential are getting up, employing a massive number of people, turning on light switches, pushing 5, 10, 15 million pound contracts out the door. And there might be some strategies guiding that, often there will be, but I think for me, it is the opportunity to make all of that sing together and have a much greater collective impact, and to try and make sure that each kind of action that it exists in making these organizations get up and running is thinking about the benefit that it has for the communities it's based in. So I think that there is just such a huge prize here when you think about the resources that go into anchor organizations and their potential impact. If you were even to just achieve a 1/10 of that potential, it would be enormous.
Yeah, and thanks, William. I mean, my first job was in politics, so I often change my 30-second pitch depending on who I'm talking to. But what I would say, I'm just going to speak from a citizen. I live in Brighton now, and whether my NHS leaders know it or not, and whether they feel it's fair or not, I'm judging them and holding them responsible for improving prosperity for my city. You know, and the reason the reason I'm here, the reason I invest here, the reason my children are being brought up here, my vice chancellors, my NHS chief execs, my local authority chief execs, I'm holding that leadership group responsible for making my place prosperous and healthy and wealthy. They may not see that as fair, they may not see that as their job, but as a citizen, that's how I'm viewing them. And I think that's a fascinating challenge. And we need to understand with this agenda comes opportunity, but it starts from a place of responsibility.
Excellent, thank you. And we've got some great comments coming up in the chat from people there as well, which I think are really interesting for us to have a look at. So last few bits from us then. So Gweno, if we can just take people through. So just so you know, we've got some other great sessions on this week with a few places left. If you haven't already signed up, there's an excellent lunch and learn on Wednesday around anchors and other sectors. On Thursday, we have a fascinating session that looks at how some organizations, some anchor organizations in North America have really taken specific actions around racial inequalities, which is really interesting. And Friday, we're going to give you an opportunity in the morning, first thing, to just actually spend some time with other people and give you a networking space. And then a plenary where Julia, Michael, and some others will be coming together to reflect on the week and to pick up some of these themes throughout the week. I see Gweno has put that into chat. So thank you everybody for your time today. In the last 2 minutes, we'd just like to get one last bit of feedback from you. So there is about to be a pop-up poll. So please give us your honest feedback. We've got 3 questions within that. So firstly, just say whether you found today useful or not. And then what we'd like to do secondly is just get you to answer those questions. So in the chat, I used to think, but now I think my biggest takeaway is, and I want to learn more about. And so if you're coming to any of our sessions this week, you'll see that we're going to be asking these questions regularly. This is to help us understand what's most useful for you. Please do fill into the chat those answers to those questions, and we'll leave the poll open. But thank you very much to both Julia and Michael. Thank you for coming today and giving up your mornings. Yeah, I thought there was some great discussion and some great questions. Thank you so much to the people who participated today for the opportunity to really have really honest and interesting dialogue, because I think for us, one of the things that's exciting about this is it's well, as Julia said at the start, it's quite a new area in some ways, but also people have been doing work in these spaces for a very long time. And so to understand what you're interested in, to understand some of the places you're coming from is fascinating to us. In the last few moments, Julia, Michael, anything you would like to say?
I was just going to pick up on that one. It's so interesting to see evidence coming out so clearly. I think that's a really interesting area to unpack. And I think that what we do have is a lot of anchors that are collecting data about baseline data and kind of the impact of specific strategies. So I think this is an area where people are really trying to collect live data as they go. And that's something we could unpack a little bit more as we go through the network.
Brilliant, thank you. And if you haven't voted, please do vote. But also I can see some of you are putting into the chat any of those questions would be hugely helpful to us. So anything you've taken away today that's new, so things you used to think but now you think, big takeaways and things you'd like to learn more about. Michael, from you, last word.
Just to say, it may well be that there's something happening, you know, that place partnership and place leadership means that there will be something happening locally. There will be conversations going on, you know, there will be issues being addressed, you know, pick up the phone to your local place partners. You know, we should be talking to them on a routine basis anyway. You know, start these, you know, if we haven't started our relationships yet, let's start them now and let's live them, and the network will help you live them.
Brilliant, thank you. So thank you so much all for coming on today. Hopefully I'll see some of you later at the employment, work and skills session and some of the later sessions during this week. Thank you, Julia. Thank you, Michael. Thank you, Gweno, for again keeping our tech running marvelously, but also being the genius behind designing these sessions. And we shall see you later in the week. Thank you and have a great day.